Uganda's first reported Mpox cases were imported from the Democratic Republic of Congo. 2 pregnant women came seeking antenatal care, and since then, the outbreak has grown, prompting the World Health Organization to declare Mpox a public health emergency of international concern.
Now we've seen it in children, and we are now following that trend of spread is usually the people who are movers. Movers in our country, we include truck drivers, people who move from border to border, and then we also see another group of people who are commercial sex workers and their clients. Over the time, we've seen that the most common mode of transmission among those clusters is sexual contact, person to person, because there is a skin-to-skin contact. That's how the disease is mostly moving from one person to another, through sexual contacts, through kissing, through touching of their fluids, intimate touching, and also the linen. You are sharing the bed sheets, you are sleeping in the same bed.
Symptoms of Mpox typically develop between 1 to 21 days after exposure. They include fever, fatigue, back pain, and rashes that progress from nodules to fluid-filled blisters, eventually crusting over.
As the rashes also come out, they start by small nodules, then they become blisters with some fluid you can see, then they burst out, and then they start crusting, getting like a scar, which drops off. Then the whole cycle of the skin is over. This can take between 2 to 4 weeks. So the long incubation time and time of disease is making the control difficult. You can imagine if it happened after 21 days, you get symptoms, and then you are not cured until 1.5, almost 2 weeks to 4 weeks. We are talking about almost 1.5 months to 2 months, one person being sick. That long time exposes many people to infection. Usually people don't infect others when they are not having any symptoms. When they're just prodromal stage is a stage where we think you don't have signs or symptoms, but you're already infected. There is limited time for transmitting the disease at that time. But we also see that people get rashes, especially on the extremities, on the hands, on the face, on the feet. But if you also got the infections through the sexual contacts around.
The outbreak has hit hotspots like Kawempe and Makindye divisions in Kampala particularly hard. The Ministry of Health traced clusters of infections linked to commercial sex workers and their clients.
We have been able to follow that 2 commercial sex workers were able to infect over the period of 2 months, a chain leading up to almost 40 people. So we give supportive management to prevent death. We do not have a definitive treatment for Mpox per se. Some other antiretroviral drugs are being repurposed or being studied to see whether they can help in the treatment of Mpox, but we don't have, and some have been approved for emergency use, but they're still in clinical trial phase.
Mpox cases are also being reported in new districts, with Nakasongo and Kampala remaining the hardest hit. Surveillance teams are actively tracking cases and contacts to curb further spread.
Sex workers and their clients are driving the epidemic hotspot in Kawempe. Next to Kawempe is Mwesigye division as well in Kampala. So those are the 2 kind of areas. The moment we are able to understand the epidemiology and the people who are sick in the locality, then we are able to target our messaging and following them up. And unfortunately, when we also test these people, they turn out to be HIV positive. Some of them are HIV naive. They don't know their HIV serostatus. So they're the same people engaging in very risky behavior. By the way, it can also move from animals to people, but we don't know which reservoir it is now currently, like in the normal animals we have in our domestic animals, which is a reservoir which can keep the disease, and once in a while it spills over. What we know that in Uganda, the disease was just imported.
Prevention efforts include isolating infected individuals and exploring the use of ring vaccination for contacts and their immediate contacts.
And give these people prophylaxis vaccination. So once the new year starts, we'll be able to have new vaccines, and these close to 1,000 people that we are following will be the people we target to give the vaccines before they show signs and symptoms, and make sure we prevent. That's what is called ring vaccination.
The Minister of Health remains on high alert, concerned about the potential spread of Mpox to new districts. They urge the public to follow health guidelines, especially during burial ceremonies, to avoid further transmission.
Invite the health teams to help with the burial so that we don't see more of the infection during the burial process. So the way we handled our earlier dignified burials when we're not so sure of what we're dealing with, I think in case of any disease outbreak, we should have the professional people help handle in a hygienic way. I know in our cultures, we love to wash the bodies, we love to wrap them ourselves, but we can we can delay or stop doing all those cultural practices of handling dead bodies because we are handling new infections which can spread to one person to another.
With more than 107 patients currently admitted and 7 new districts reporting cases in recent weeks, Uganda is at a critical juncture in its fight against Mpox. The Ministry of Health is calling for vigilance, swift reporting of symptoms, and adherence to prevention measures to stop the spread of this disease. Walter Mwesigye, NTV.